Hello there, this is John, and I wanted to give you some insight into the application of a CPAP device on a patient out in the field. As EMTs in the County of San Diego, if you're working with a paramedic on a fire truck or an ambulance, more than likely you'll be doing this for the medics. You'll be assembling the device, you'll be applying it to the patient, and you'll help them monitor the patient as well. Even though this is within your scope of practice per the county skills, generally, you're going to be doing this with, paramedic approval or direction. So first things first, indications. It's really important you understand the indications. You can read S136 of your protocol book, but ultimately this person's going to have a breathing problem. They're going to complain of not being able to breathe adequately or effectively. And consequently, they're going to have accessory muscle use. The saturations might be a little bit on the normal side. They're going to feel short of breath. The big clue here for CPAP is they have to be awake, alert, and talking to you, and their tidal volume and their rate has to be somewhat adequate. Now you're thinking, well, wait a minute. Why would I need to use CPAP if their rate is adequate and their tidal volume is adequate and they're talking to me? Well, the reason why this all is because majority of patients who are short of breath, usually it has something to do with their alveoli. Imagine if this person has congestive heart failure or they're drowning patients. In both cases, they have edema in their lungs, and that edema causes the alveoli to collapse. So if the alveoli are collapsed, they can't exchange gases. So even though their rate and tidal volume is somewhat adequate, whatever is getting in is not exchanging into the bloodstream, so this is why this person's hypoxic. If this person were in a house fire or they were exposed to chemicals and inhaled them, and now the alveoli has been damaged, again, they might collapse. They might not function effectively. Someone who has emphysema or chronic bronchitis, the same thing. Again, the alveoli is kind of the culprit here. So what this device does is, and it goes just by the name, it's positive pressure, airway pressure device, right? It pushes air into the lungs, it fills the dead space, it fills all the voids, it opens up the lungs, it distends them, and it distends the alveoli. It opens up those little sacs so air can get in and gases can exchange, and it can resolve the hypoxia. So most of your patients who have difficulty breathing the key here is they're probably going to be something related to their alveoli, and CPAP possibly can help. Now, again, this is going to be up to the medic to decide on this, but again, you guys get the idea. Now, the contraindications are many, which we will discuss in the classroom, so I'm not going to waste that time here with this. It's in your protocols if you want to look it up, but we'll definitely discuss it during the lecture portion of Chapter 10. Now, when it comes to the application, if you think about what we learned so far in the class and in the lab, is we try to think BLS before ALS. So we got Bob right here. Bob's an 86-year-old male. He's been having some shortness of breath for the last 3 or 4 hours, and he's got a little bit of chest discomfort. And you arrive on scene, you do your assessment, he's awake, he's alert, he's answering questions effectively, he's breathing okay, it's a little labored, he's got some accessory muscle use going on here, his saturations are 80% on room air, his tidal volume seems to be somewhat adequate, and you're thinking, okay, breathing problems, put some high flow 2 on him. So you put a regular old non-rebreather on, 15 liters per minute, you're doing your assessment, you're getting your blood pressure, your other stuff going on. 4 or 5 minutes goes by, and you notice, gee, saturations really haven't risen all that much. They're a whopping 82% now on the high flow 2. So again, that's telling you there's a disconnect between what air is getting in and what air is getting through the alveoli. So now you know this is probably a problem for him. So because he's awake and alert and talking to you, and his breathing's, he's breathing on his own somewhat effectively, he's good for probably CPAP. Now, you're going to open up the packaging and you're going to pull out the tubing. And the tubing is pretty straightforward. There's 2 ends, like most tubings. This is the end that attaches to your regulator. There's a little like a little cap here. It's threaded, and it threads onto that high pressure nipple on the side of your regulator on your oxygen tank. And once you thread this all the way on, it automatically starts flowing at about 50 liters per minute, pretty high pressure. It goes down the tubing, and this is an oxygen generator device. And what it does is it sucks air in from the outside world. It mixes the oxygen with ambient air, and it increases the volume and pressure through the tubing. Now, this tubing comes pretty short. You can stretch it out. It's got an accordion kind of setup there. So the pressure is flowing through here. It comes out the port right here where the mask is applied. There's a way of adjusting the amount of pressure the patient's delivering. This is measured in centimeters of water. It's 5, 7.5, and 10 centimeters of water. The county says 10 is the max for us. It always comes set at 5 initially. We always try to start at 5. We're especially concerned about people who have COPD, emphysema especially, because high pressure can actually rupture their lungs. So we keep it at 5 and see how they do. If they don't improve, then the medic can turn this to the next higher pressure. Kind of makes sense. The mask itself just attaches right onto here, and it's ready for application. There's some straps that go around the back of the head and along the jawline and clip down the lower part of the mask as well, around the back here. There's a pad for their forehead. It's adjustable up and down to adjust for comfort, because these are not super comfortable, unfortunately, with these. Again, these are one-time use devices. The county would like us to add one more piece to our inline system, and that is going to be a HEPA filter. This HEPA filter basically just blocks out pathogens. So as this person's breathing out, that way, I guess, out, it will trap the COVID or flu or pneumonia or whatever they might have. And this is what it would kind of look like. Now, this is an older device. The newer ones in the field, there's another port right about here. It sticks down. It's got a little cap on it. And that's for providing this person with some type of inline nebulized treatment. Now, that's more of an ALS side of this. The medic's going to do that. They can measure out the medication. You can stick it in there. They'll turn on the gas and all that and get things flowing with that. But that's another option with the newer devices anyway. So now that I have this thing assembled, my patient's still awake and alert and talking to me. His saturation is still pretty low, so I want to apply this to the patient. So I always ask my patients, and they can nod yes or no if they're having problems with this. Have you ever had CPAP before? And they say yes. Have you tolerated it? And they say yes. That's bitchin'. I like that. If they say no, I want to coach them through this process. Explain what this is, how it works. Explain that it's going to push air into their lungs to help them breathe better. They might feel a little claustrophobic at first. So I'm going to have them essentially hold this in their own hand, and I'm going to put this on their own face. Remember, they're awake, alert, and cooperative, so they should be able to do this, and have them hold it to their face until they feel comfortable with it. They might take it off for a few seconds, but put it back on. Encourage them to try to get them comfortable with the device. Once they can tolerate it, then the straps go on over the back of the head and clip on the sides here, and then you secure the Velcro down until there's a comfortable seal around the person's nose and mouth. And of course, it's resting on the forehead. It's really important that we coach them, through this process, because it is rather frightening. They are short of breath, and it's almost like initially it feels like they're being suffocated. Now, there are some drawbacks to this, and I've seen this in the field a few times. You got to be really careful with these patients. If you think about Bob right here, Bob's been short of breath 3 or 4 hours. He's been having accessory muscle use. He's kind of tired. He's actually wearing himself out from breathing so hard and for so long. So when you put a CPAP device on a patient like him, he has to breathe out against that pressure that the device is providing. So he uses more energy to breathe out than breathe in. And what can happen is he gets so fatigued, he stops breathing or he goes unconscious. So if you have a person like Bob here and you're on the way to the hospital, you got to watch them carefully. If their head starts bobbing, or they stop talking to you, or they go unconscious, or they stop breathing, the CPAP's got to come off. They're too tired for it any longer. So in that case, what you're going to do, and this is a really important step, remember, this is on the patient's head. It's being held in place by all these lovely Velcro straps. And this person is no longer breathing. They're unconscious, semi-conscious. Pull everything off. Get it out of the way. Turn off the oxygen. Grab a BVM and stick the BVM right into this port right here. Don't take the mask off. The mask is secured on this person's face. It's got a great seal. You don't have to worry about CE grips or anything like that. Just stick the BVM right in here and start ventilating. It's a great device. The moral of the story is you got to watch these people really carefully because they will stop breathing, they will go unconscious, and you might not notice it. But keep talking to them, keep interacting with them, make sure how you're feeling, watch their saturations, see them going up or not, and just keep track of these people because they start nodding off, and next thing you know, they die. So great device, but again, only for a narrow population of patients, and on top of that, there are some risks to these. So I hope this helps you, and I'll see you guys in class.